Hey YouTube, it's Nick Mac coming at you. Wanted to do a quick update video from what's going on with my revision surgery. I would like to thank all of my new subscribers, people that have visited my page and just kind of given some encouraging words. I truly do appreciate it. So thank you. I haven't gotten to respond to everybody, but just to kind of give a blanket statement to the ones out there, to the pre-sleevers, post-sleevers, this is my journey. It is not. I feel like my situation is atypical, and you know, it is what I'm having to go through for whatever reason. I don't believe that it will be others' fate, but if it is, I hope my videos prove to be helpful, which is exactly why I started out doing this in the first place. So let me just kind of give you guys an update about what's been going on. Just to kind of go back a little bit, I had surgery February the 28th of 2013. I've lost a total of about 40 pounds in a span of now about a year, which is not very typical for gastric sleeve surgery patients. I am hungry. I do get hungry. I work out religiously. Let me say that differently, to be honest. I did work out religiously. I trained for a 5K last year and actually ran a 10K. And when it started getting cold here in North Carolina, I really did just kind of stop working out. And I'll be honest with you guys, at that point I became very discouraged anyway. I was working out a lot. Eating healthy, and I was not losing any weight. I got to 200 pounds and I could not lose another pound. I have been stuck at anywhere between 198 to 200 pounds for now 9 months. 9 months. I've not really, I wouldn't say I've gained weight or lost weight. I just fluctuate anywhere between 198 and 200 pounds. 198 is about the lowest that I've seen since my journey. Again, my experience is not very typical. I went to my doctor who did my surgery several months ago, and what he told me was what changed my path. And he essentially said to me, oh, we'll just put you on diet pills. The whole reasoning for me having this surgery was so that I could not ever have to crash diet again, fad diet again, or take another diet pill. To be told that was very disappointing and discouraging, and I sought a second opinion because I felt like something was truly wrong. I knew that I was doing what I was supposed to do. I found another doctor here in North Carolina, and Dr. Vollinger has been a godsend so far. He listened to me, and he decided that I needed to do another endoscopy. I did an endoscopy December the 24th, 2013, and that endoscopy showed that my sleeve was mal-shaped. It essentially shows dilation at the top of a sleeve and dilation at the bottom of the sleeve, and then I'm sleeved somewhere in the middle there, which creates a few things. One, I can eat small portions and I'm full. I have that sensation of restriction, and I'm full very easily. But within a matter of an hour, 2 hours, I'm starving because now my food has left that top portion, gone through, and now has gone into the lower portion of my sleeve, and I'm hungry again. That hormone that is released, that is taken out usually from gastric sleevers, evidently was left because I still have a lot of stomach left. So essentially, I guess if I could say it differently, my sleeve was left way too large. So with all that being said, I have gone through this process with my new doctor since October of last year. of trying to get in to see him doing an endoscopy in December, January trying to figure out, trying to get back in to see him again and figure out what do I need to do, and working with my insurance company to see how they will pay for revision surgery. Thank God my husband's employer picked a great insurance plan as it relates to this surgery. We have Blue Cross Blue Shield of Michigan, and their criteria to be re-sleeved or revision surgery to be done essentially is a letter of necessity from the doctor. Essentially saying, this is why this patient needs surgery again. And it can't be because I just didn't feel like I didn't lose enough weight. That's the only reason they won't pay for it. But if there's something else medically going on, which is the case for me, they will pay for the revision surgery all over again. No strings attached. So that is a blessing in itself, and I recognize that. Other people who, other insurance companies often make the patient go back through that long, arduous process of seeing a psychiatrist, doing 6 months of blah, 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 all these things. And my insurance company is not making me do that. So I'm very, very fortunate and blessed because of that. So now all I am doing is waiting for a surgery date. I know a lot of people see my videos and they can tell, from my face, I don't do full body shots or anything. I mean, I have a problem doing it, but they can tell from my face that I've lost weight. But, I'm 5'4" and a quarter. I don't ever like to leave out my 5'4" and a quarter. And, I'm just not happy with being 200 pounds at 5'4". My ideal weight and my ideal BMI doesn't even mandate this is a healthy weight for me. So, to go through this journey and have only lost really, 36 to 40 pounds, it just, at times I felt like it wasn't worth it. So, see, that's why you see a lot of my videos titled My Gastric Sleeve Regrets. I guess if I had to do it differently, of course, I would like to have done it another way. But I just believe that, I would like to, some people would say, well, why me? Why did this happen to me? And I've just recently began to realize, well, why not me? Maybe this will help somebody going through this. I hope it doesn't discourage anyone from doing the surgery, because that is not ever what I want to do. If you've done your research and this surgery is for you, and you feel that it's for you, and you've prayed about it, and or whatever you do to come to decisions in your life, by all means do it. Because I know that it works. I mean, I started this journey with a couple girls that I know, and they've done very well. And they don't work out. They don't do half the things that I've done. But they've done very well. They've lost the weight and they feel healthy and they look good. I'm just not, I don't think anybody would be happy with the results that I've had. So that's why I've chosen to go through this revision process. I ask that you guys keep me in your thoughts. Keep the positive comments coming. I truly do appreciate them. I will respond when I can, but I hope that I'm answering a lot of people's questions in this video, because a lot of people have expressed to me that they're nervous, that they're scared, and you should be. But it doesn't mean that you don't do it. It just means you should enter into any surgery, any life-changing situation a little cautious and a little nervous. That is absolutely normal. So that's all I have to really share this week with you guys. When I get my revision date, I think you guys will probably be the first ones to know. And that's it for me. good weekend, and thanks again, everybody.